One of the determining factors that she felt comfortable stepping away was the fact that I could tell her that she wasn't going to be leaving in handcuffs in a police car.
We're learning more tonight about how a new team in Tulsa helped prevent a woman from committing suicide. She was standing outside the guardrail on the Peoria bridge over the BA for several hours yesterday.
The unique three-person team includes a police officer, a paramedic, and a therapist. The goal is to keep people out of the hospital and out of jail, and instead get them the help they really need.
She hadn't felt safe sleeping outside for the last couple of days. She hadn't been with food for several days.
This was the scene yesterday afternoon as the Crisis Response Team, or CRT, tried to talk a woman to come back safely onto the bridge.
She just needed resources that she felt she couldn't get.
The team is on the road 2 days a week.
We now strategize together prior to a call, try to formulate a plan.
The officer looks into their criminal background. The paramedic finds out if they've helped the person before. And the therapist from Family and Children's Services COPE's program checks their records.
COPE's responds 24/7, 365 to individuals who are suffering from some kind of a mental health crisis, but we look at being a part of CRT as kind of a force multiplier. We're able to see, did they miss an appointment? Did they not pick up their medications? Do they have a specific diagnosis?
And when they get there, they each have their own roles.
That medic offers the ability to really understand their healthcare conditions, really understand what medicines they may be taking that are interacting, or we can treat injuries or illnesses right there.
According to the CDC, Tulsa ranks 15th in the nation for suicide rates. In just 8 months, CRT has already responded to 80 suicidal 911 calls.
This becomes the model of the future. We are changing the way to do business, and we are setting the example and the standard for across the nation.
Now, every year, COPES gets 8,000 to 10,000 calls. Tulsa's 911 gets more than 13,000 suicidal calls. CRT is on the road Tuesday and Wednesday, all thanks to the United Way and private donors, but they are hoping to expand.